When we're talking about a herniated disc, most people, if you took 100 people without back pain and you gave them all an MRI, about 80% of those people would have a bulging disc or a disc herniation on their MRI. But why don't they have pain? Good question. Another question is, how does a herniated disc work, and what can I do about it? So here you have bone, bone. Most common level is L4, L5. L4, L5. So you have bone here, bone here. The picture is taken from the side, so the person's stomach would be right here, and their back is here. This is the spinal cord running down. In between each level of bone in your back, you have a nerve root coming out. The disc is in this space right here. Okay? So in the center, there's a hard, bony-like substance, that's your disc, and then it's surrounded with a gel, okay, like a toothpaste consistency. And that's held in by layers and layers. It's like a wicker weave of fibers. Big fancy term is annulus fibrosus. That's the fibers that hold that in, okay? And what happens is, at first, you just get a little disc bulge. So the disc pushes out the back, begins to bulge out. Very rare that that would cause pain. Next level is a disc herniation, and that's where the fibers actually start to tear, and the disc material and that toothpaste-like substance begin to push out through those fibers. So you're getting even more pressure out into the nerve. As that happens and that hits the nerve, that's what can send that sharp shooting pain down the back of the leg. For most people with a true disc herniation and nothing else going on, when they bend forward, it will stop them in their tracks. They could have trouble breathing. They'll have sharp shooting pain down the back of their leg. They'll be able to trace it just like this. That's called sciatica. This is one of the causes of not only lower back pain, but also sciatica. So what we want to do is we want to move that material forward. Another important question is, can a herniated disc heal? In our clinic, from our experience, and also what research shows is yes. For some odd reason in our area, a lot of people don't think that that's possible. It is possible. It takes a little bit of work and a little bit of know-how, but it's very possible. So when we do exercises for a herniated disc, one of the common things that we'll do is bend backwards. What happens is that pushes all that material forward, allows this to heal, takes the pressure off of the nerve. What the person usually will experience is less and less pain in the leg. So let's say I see a person, they're having sciatica the whole way down to their foot. They do this sort of movement. We do it laying on their stomach, standing at the wall, 100 different ways. So we do that, we get that material to go forward, that herniated disc to go forward, relieve pressure on the nerve, and what they will say is this: I don't have pain in my leg now, but I have it in my buttocks or my back. When that happens, that's called centralization. That's exactly what we're looking for, and we know that we're on the right track, and the person does have a disc herniation, and they do have hope. They do have hope of healing. So we want to push that material forward.